Hi friends, myself Ashish Deswal. I'm a practicing physiotherapist in New Delhi. I'm also elected council member at Delhi Council of Physiotherapy and Occupational Therapy. So this video is about the new latest vacancy circular for National Council for Allied and Healthcare Professionals. We all know that NCAHP, it's a act and now it's a law in India that basically we can say regulate the professionals of 56 category, and that all the categories are divided into 10 major categories. All 56 professionals are basically categorized into 10 major professionals. So here are basic category, which is medical laboratory and life sciences. So a consultant post for this medical laboratory and life sciences is required at NCHP, and the last date for this is 26th of December. And for all the categories, we can say we want a consultant for trauma, brain care and surgical anesthesia related technology. Next is consultant physiotherapy, consultant nutrition science, and consultant ophthalmic sciences, consultant occupational therapy, consultant community care, behavioral health sciences, and other professionals. We can say consultant medical technologist and physician associate, consultant health information management and health informatics. The 10 total post for this consultant for a salary of 60,000 on a contractual basis is released by NCHP, and also with this for 5 senior consultant posts are there with a good experience. Definitely the role and responsibilities, as we all know that consultant post is basically to, you can say, frame the policies, we can say to frame the laws, we can say to frame the curriculum, we can say to frame the code of ethics for this profession, or there are multiple things a part of this. So it's an interview based post, we know that. And role and responsibilities basically said technical assistance we have to give to support to the council in framing the policies and standards for the governance of education and professionals. Services of recognized category mentioned in the schedules of NCHP Act, that is 2021. And it's basically include regulation of professional conduct, code of ethics and ethics to be observed by the professional. See, we can say basically how to function a National Council for Allied and Healthcare Professional. These consultants have to frame the guidelines for that, how to regulate a profession, how to basically run and to maintain a live register for this. To support creation and maintenance of an up-to-date online and live center register for the allied and healthcare professional in accordance with the regulations. See, up-to-date maintenance of live register is very important for any profession, so that government will definitely create a policy matter for that. Any profession have some steps, we can say, to grow. If government doesn't have the number, they can't plan for the vacancies, they can't plan for the future growth of that profession. And a part of this, government need definitely manpower to run a department, and that department is basically uh, planned in a future way. We can say planning is a future prospect. So congratulations to all that this major step is taken by NCHP, and um, we must thank government also for this, that finally a law has been brought up in India that regulate all these professionals. Develop of scope of practice. See, all the medical categories, all the allied and healthcare categories are with the align of medical profession. So we have to work in a team. So here the scope of practice must be regulated. We have to know what is our domain, what is our, we can say, area of work. See, eye surgeon can't do uh, like dentist work. Okay, they are specialized in that. So world is moving from generalized to specialized. Okay, same like nowadays many of the old techniques are going away. Physiotherapy is basically a drugless therapy which definitely help to well-being of the society. Okay, then research, definitely the research must be aligned with the uh, industry. Okay, to undertake research and to assist in the formation of basic standards related to thematic domain of education. See, our education is organizing the things. Okay, industry have some demands and education have to fulfill it with the latest implementation of skills. Okay, so including course and curriculum, here the most important thing is what to like give to the students of healthcare professional and allied health sciences must be taken care. Physical and instruction facilities. See, instructional facilities must be created. How to teach, what like how to teach, what to teach, staff pattern and desired qualifications. We are lacking hierarchy in our staff. Okay, any allied and healthcare professional is basically not hierarchically placed. The hierarchy is created over a period of time. Okay, so desired qualification for that post, desired qualification for this. Basically, we have to create different levels of job descriptions. Okay, job description must be created by well research after doing a well and good part of research. Quality instructions, then assessment, examination, training, research, continue professional education. See, here I feel very much emphasis on this part is continuing professional education. See, if I am doing a Bachelor of Physiotherapy and uh, let's say anybody is doing a MBBS degree or a BDS degree or a MLT degree or we can say occupational therapy degree and like say dietitian will do a BSc in dietetics. After a point of time, the industry requirements will be changing. So for that, we need continued professional education. CMEs we can say, CPEs we can say, continue physiotherapy education. Conferences are there, workshops are there, but we definitely emphasis on the part of uh, from where do these conferences, research, webinars are affiliated. Okay, affiliation is very important point. See, one professional is doing let's say 100 of workshops. Okay, but nowhere that conferences are counting on its professional career. Okay, so this is a very important part. I definitely feel emphasis on this and coordination with the boards and related guidelines. See, uh, recently we see in Gujarat there is four boards are nominated. These four boards are postgraduate, okay, undergraduate board to regulate these professions that is in that state. Okay, so let's say Gujarat is formulating this undergraduate board which regulates undergrad degree for that particular, we can say, profession. A part of this, NMC has all four boards. Same four boards are coming in NCHP also. That is a very good part. So that the requirement for BPT, MPT, and higher education, ethics, all this will be sufficed by this. To support in the decision making process by necessary research on the qualification to be obtained by professional, any may be specified by regulation. See, decision making, necessary research. Most of the time, the curriculum is not updated over, let's say, 40 years, 50 years, 60 years. But AI is coming, IoT is coming, artificial intelligence nowadays. Later on, like let's say later on, maybe there are robotics included in healthcare and allied sciences. We have to learn how to operate their devices. Okay, to support in creation of a framework for uniform entry examination. Here, let's say medical courses are having NEET. Okay, NEET is, we all know, NEET UG, NEET PG, and they have a proper counseling for admission. So here the consultant want a job description to form a uniform entry examination for all over India. Let's say all 56 professions are listed under this exam, and anybody wants to choose from these 56 professions. So this streamlined the process of admission in these courses. Okay, into allied and healthcare institution at an undergraduate, postgraduate level. So here, this is very important. I'm saying NEET UG, NEET PG. Okay. So here, maybe a universal exam will be conducted to select courses from these 56 categories. Okay. So government has control over the number of seats, the number of professional graduates from these courses. This is a very important, and I must say one more thing. If let's say NMC is conducting a screen out test, see, a part of passing from annual examination, we must, we can say, do a quality control on the passing out point. Like we have a exam at entry point, we have to conduct an exam at entry, sorry, exit point. We have to conduct an exam in exit point also, which basically cater the quality of the professional. Okay. Next is to support and contribute to design of minimum standard framework for machinery, material and services for related profession. This is next a very important topic which must be taken care of. Let's say we are using physical modalities in our clinics, physical agents we are like using in our own clinics, and more or less there are way much things which are used by all the professionals. All the category of professionals are with somehow with definitely with the machines material. We must we can say we must have some control over the this machinery. I'll give an example of, let's say, TENS, transcutaneous electrical nerve stimulation. That will be definitely at comes at a price point of 1500 rupees at Amazon, and that is coming out at a point of let's say 50,000 rupees by all the, like we can say, major brands. Let's say Chitanova, HMS and all this. We have to certify those devices with NPL, National Physical Laboratory. The amount of frequency, the amount of current which comes out from that electrical pad must be measured over from time to time. It's not that only TENS is given to patient. We have to certain the quality of the device, and that here that the role comes here for this. We have to create specifications. This certification is for, let's say, CE certification is there. Okay, internationally CE certification is mandatory for we can say uh, different modalities. Let's say ventilator have some different kind of surge protection, and to create various levels of interpretation or specific frequency. Support and contribute in digitization of learning, examination and other related process. See, all over the world, digitalization of learning is going on. We all know that most of the courses are MOOC courses, mass open online courses. But we can't move to this way. Physiotherapy, occupational therapy, and any allied and healthcare professional is a hands-on task. We have to be aligned with the patient's uh, condition. We have to train along with the patients. So this must be take care with that point of view. Examination and other related processes. Most of the countries are having their own licensing examinations. USA has NPTE, Canada has PCE, Dubai has DHA, Germany has other exam, USA, or sorry, we can say Australia has AHA exam. Every major country, first world country, is having their own examination pattern. We must take care of that. Any examination, let's say USA is having specific examination for specific state. There are 52 states, that is United States of America. Then there are 52 examinations, 52 different examinations for particular state. They have their own ethnicity exam, they have their own law and like say law and legality exam. Any health and healthcare professional is having some legal complications while treating a patient also. Nowadays, legality is a major concern. We have to think of that point. To understand necessary literature review and research regarding global understanding and parity in education. We all know that India is basically supplying every profession, every professional to the like first world countries. We are giving our doctors, we are giving our engineers, we are giving our physios, occupational therapists, and healthcare allied professional nurses is definitely a major part of it, like dietitians nowadays. So uh, we have to align our curriculum and their curriculum must be at part. Otherwise, what will happen? A very small course of, let's say, dressing course is not included in a curriculum. That course will be paid by the candidate extra, okay, on extra fees, and that fees is not small. It's maybe $500, $1,000 for that particular. The credit point is, let's say, 0.5, but uh, we can say this must be aligned. If it's like it's taught at the level of UG or you at the PG, that candidate doesn't need any extra credit for that. Next is to support framing of guidelines in thematic areas including performance management system, task shifting, career development pathways, development of strategic framework for regional delays of skilled manpower. See, we have a demography all over India. The concentration of some allied and healthcare professionals are at some point of demography, but we have to relocalize that. All over India needs that. The well-being of India is in total want this. So development of strategic framework for rational deployment of skill map. That's what I'm saying. No? This is the way the government will plan that this manpower is used for this purpose. This skilled personnel is used for this purpose. Nowadays, at primary health centers, people are posted for this. Let's say uh, government has to plan which services need at tertiary healthcare center, which services needs at primary healthcare center. So recognition of qualification, institution, reciprocity of qualification, related profession. To conduct periodic monitoring and reviews, visits, systematic data collection, prepare reports, follow up the states, and provide technical assistance to the ensure timely completion of activities. Uh, Definitely, this systematic data collection provides the organizing capacity to NCHP. See, one is planning. Okay, next is organizing the things. If we organize our manpower so well that we have to think that after, let's say, 20 year of down the line, we need this much profession on this part. So we have to plan accordingly. Now we are the youngest country of the world. After a point of time, we will be like losing this leverage over time. So thank you from my side. This is basic interpretation of duties at of consultant NCHP. Thank you so much. Thank you so much.